Hello friends, take a close look at these three lateral skull x-rays. At first glance, they may appear similar, but their clinical significance is very different. Let's start with the image on the left. This is the classic copper-beaten skull. Notice the numerous rounded shallow impressions scattered over the inner table of the skull. These markings resemble the surface of hammered copper, giving the sign its name. These impressions are produced by chronic pulsatile pressure from the growing brain against the skull. When intracranial pressure remains elevated over time, the inner table remodels, creating this characteristic appearance. Common causes include hydrocephalus, craniosynostosis, intracranial tumors, and other causes of chronic raised intracranial pressure. Now look at the image in the middle. Some authors use the term silver beaten skull to describe a more pronounced version of the copper beaten appearance, particularly when the convolutional markings are very deep and extensive. However, it's important to know that silver beaten skull is not a universally accepted or standardized radiological sign. In much of the radiology literature, the terms are used interchangeably, while many texts recognize only the copper beaten skull. So always follow the terminology used in your institution or examination system. Finally, examine the image on the right. These are normal developmental convolutional markings commonly seen in children between 2 and 7 years of age. Notice that the impressions are fine, symmetrical, and relatively shallow. The child has no clinical evidence of raised intracranial pressure, and these markings simply reflect normal growth of the cerebral gyri. So, how do you differentiate normal from pathological? First, assess the clinical picture. Headache, vomiting, papilledema, increasing head circumference, developmental delay, or sixth nerve palsy should immediately raise concern for raised intracranial pressure. Second, evaluate the extent and severity of the markings. Diffuse, deep, and widespread impressions involving much of the calvarium are more suspicious than mild, localized markings. Third, look for associated radiographic findings such as widening of sutures, suture fusion in craniosynostosis, macrocephaly, or other skull abnormalities. And finally, remember that plain radiography alone is never sufficient to diagnose raised intracranial pressure. Whenever clinical suspicion exists, the patient should undergo CT or MRI to identify the underlying cause. The copper beaten skull is an important clue, not a diagnosis. Always interpret it in the context of the patient's age, symptoms, neurological examination, and cross sectional imaging. Recognizing this distinction can prevent both misdiagnosis and unnecessary alarm. Follow for more high yield radiology signs that make everyday X ray interpretation easier. Thank you.